Hello everyone, I'm Anastasia signing in from Nora's. In our previous session, as we have started discussing about the alterations in bowel elimination, there we have come to know that there are 5 conditions that can lead to this alteration, and those include the constipation, the diarrhea, bowel incontinence, bowel impaction, as well as the flatulence. And we have also discussed in detail about constipation and diarrhea. Now, in this session, we will be discussing the remaining 3 conditions, which is the bowel impaction, bowel incontinence, and the flatulence. So let us first discuss about the bowel impaction. Bowel impaction is a condition in which there will be presence of mass or accumulation of hardened feces in the folds of the rectum. This condition usually occurs when there is prolonged retention or even because of the accumulation of fecal matter. So here, because of this prolonged retention where a person is not defecating, even when he or she has the urge to defecate, or if there is accumulation of the hardened feces in the folds of the rectum, then this condition is known as bowel impaction. In severe impaction, this accumulation of the fecus can also extend to the sigmoid colon and beyond. So here, in acute condition, we will find that a person will be having this accumulation of fecus. However, it will be present only in the folds of the rectum. But if the condition worsen, which means if they are having severe impaction, then it can also extend to the sigmoid colon and beyond. Here, usually the people who is having this condition will be experiencing the passage of fecal seepage and no normal stool. So now let us look at the causes of bowel impaction. So here there are various factors that can lead one to suffer from this condition. Number 1 is the poor defecation habits, as we have discussed in the definition as well, that this mainly occurs when there is a retention. So here, if a person is having the urge to defecate, but if he or she tries to control it, then if this becomes a habit, it can lead to bowel impaction. The second is constipation. So here, because of the hardened stool, it becomes very easy for this condition to occur. The third one is the medications. So here, if a person is under antihistamines or the anticholinergics, then he or she can also suffer from this condition. And the last cause is the intake of barium. So here, barium can be used in various radiological studies in order to examine the upper and the lower gastrointestinal tract. So here, because of this barium, it can also lead to this disease condition. So these are the 4 main causes of the bowel impaction. Now let us look at the signs and symptoms. So here, if a person is having this condition, it is very evident that they will be complaining of presence of fecal seepage. They will be complaining of constipation, where they will be having a hardened stool, and they will not be defecating more than 3 times a week. They will also be getting a feeling of frequent but non-productive desire to defecate. They might be complaining that they are having rectal pain. They might complain that they are having a generalized feeling of illness. Not only that, but they may also be anorexic, which means they will be having loss of appetite. They will also be experiencing symptoms such as nausea, vomiting, and also, as we know that in this condition there will be a collection of hardened fecus. So because of this, it would also lead to a distended abdomen. So these are the signs and symptoms which a person suffering from this condition might complain of. And how can we diagnose this condition? The first one is through physical examination. By performing the physical examination, we will be getting an idea if a person is having a distended abdomen, if a person is having pain, and also through digital examination. So by performing this digital examination, we will be able to visualize, we will be able to get an idea if a person is having this bowel impaction. So how can you treat this disease condition? You can do it by providing oral laxatives, by providing anal suppository, by performing the enema through water irrigation, as well as through manual evacuation. So this is how you can treat the disease condition or this bowel impaction. As a nurse, it is also your responsibility to educate the patient about his or her disease condition. Not only that, but you can also educate the family members in order to prevent the reoccurrence of this condition. So here, as a nurse, you must educate these type of patient to follow a diet which is high in fiber, and their diet must include plenty of fruits and vegetables, brown rice, as well as whole grain foods, oatmeal, fruit juice, as well as the various other unsweetened fruit juices. You must also advise them to have dry fruits, as well as you must advise them to take adequate amount of fluids. You must tell them the importance of drinking at least 1 to 2 liters of water per day. You must also advise them to perform exercises regularly. You must tell them to avoid consuming the processed foods. You must also advise them to follow the bowel training in order to help establish the regular bowel habits. And not only that, but as a nurse, it is also your responsibility that you speak to the physician and as well as get to know about the possible side effects that can occur, or if any new medications is to be prescribed, so that the same can be intimated to the patient as well as the family members. So these are few of the things that you as a nurse can educate the patient about in order to help prevent the occurrence of this condition. So this is about the bowel impaction, where we have discussed what it is, what are the various factors that can cause this disease condition, what are the signs and symptoms that one may experience, how can we diagnose this disease condition, as well as we have also discussed about the treatment and the prevention. So I hope you have got a clear understanding of what bowel impaction is. Now let us move on to the second condition of today's topic, that is the bowel incontinence. Bowel incontinence, also known as the fecal incontinence, refers to the loss of the voluntary ability to control the passage of fecus as well as the gaseous discharges through the anal sphincter. This condition can occur at a specific time, for example, after one has had their meals, or sometimes it can even occur irregularly. This bowel incontinence is also divided into two types, which is the partial and the complete incontinence. So what is this partial incontinence? Partial incontinence is the inability of a person to control the flatus or to prevent minor soiling, whereas major incontinence is the inability of a person to control the passage of normal stool. So here, if a person is unable to control the passage of flatus or to prevent minor soiling from occurring, then he or she will be known to be having partial incontinence. But if a person is also not able to control the passage of normal stool or normal fecus, then he or she will be known to be having the complete incontinence. This fecal incontinence is generally associated with the impaired functioning of the anal sphincters or of its nerve supply. This impairment can be caused because of certain conditions such as the presence of neuromuscular diseases, the presence of spinal cord injury, or even if there is presence of tumors on the external anal sphincters. So because of these conditions, it can lead to the impairment of the functioning of the anal sphincters or even of the nerve supply, and because of this it could lead one to suffer from bowel incontinence. How is this condition caused? The first factor is the constipation. So here, if a person is having constipation, then he or she could suffer from this disease condition. If a person is having fecal impaction, if he or she is under long-term laxative use, if they had just undergone colectomy or any bowel surgery, if they do not have a sensation or they do not get the urge to defecate, then he or she might suffer from this condition. Not only that, but if one is suffering from any emotional problems such as depression, anxiety, if one is mentally disturbed, or if they had just undergone any rectal surgery or prostate surgery, if there is an injury which is present in the anal sphincters during the childbirth process in a woman, then it can also lead her to suffer from this condition. If there is nerve or muscle damage which can result from radiation, from injury, or even from tumor, as well as if a person is having severe diarrhea which can lead to leakage, then he or she can also suffer from this condition. Not only that, but if they are having severe hemorrhoid or rectal prolapse, or even if they are stressed because they are in an unfamiliar environment, then this can also lead them to suffer from this condition. So these are the causes. Now let us move on to the signs and symptoms. The symptoms of fecal incontinence include a strong urge for bowel movement and not being able to control it. Here, as we have discussed in the definition itself, that this is a condition where a person will not be having the ability to control the passage of fecus. So this is the main symptom that one will suffer from. And here, when we talk about the passage of stool, then it can also be a liquid or even a solid stool. Not only that, but he or she might also be experiencing the symptoms of diarrhea, and there can also be presence of bloating and gas that can affect the gastrointestinal system of a person. So these are the symptoms that you will find. And how can we diagnose this condition? We can do it by performing the stool testing. In this, what we will be doing is we will be advising the patient to collect the stool sample, and through this sample we will be diagnosing if this is because of any infection or any other cause that he or she is having this symptom. So here, through the stool testing, we will be able to diagnose and find out the reason for this condition. The second is through endoscopy. So here what we will be doing is we will be inserting a tube with a small camera into the anus, and through this we will be able to find out if there is any problem in the anal canal or even in the colon. Not only that, but anoscopy, sigmoidoscopy, colonoscopy, MRI, balloon testing, and even endosonography can also be done for the patient in order to diagnose this condition. Here you will be getting a clear idea of how to perform these tests in your next year, that is in medical surgical nursing. Here in this subject, we will be dealing in detail about the various tests and how can it be performed. So for now, it is important for you to just know what are the tests that can be done to diagnose this condition. Once the diagnosis is confirmed, we must start with the treatment. This condition is treatable. However, this condition can only be treated if the cause is known, because once the cause is known, then only the treatment can be provided for the cause, and because of that, this condition will ultimately be treated. As a nurse, you must also advise the patient to follow a high fiber diet wherein they must consume at least 20 to 30 grams of fiber per day, because in this manner it would help to make the fecus bulkier as well as easy to control. You must advise them to avoid the intake of caffeine, as well as educate them about the importance of consuming large amount of water, because this would help to prevent constipation. Not only that, but here, if certain medications is to be provided to the patient, then you can also provide medications such as Imodium or Limotil, wherein these medications would help to decrease the intestinal motility, and because of this, it would ultimately lead to a decrease in the incontinence. You must also advise the patient to perform Kegel exercise. You must tell them to follow the bowel training, which would help them to establish a normal bowel pattern. So despite of following these non-surgical treatments, such as despite of providing the medications, despite of advising them to follow the diet, despite of them performing the exercises and the bowel training, if this condition is still not managed, then you can also provide the surgical treatment to the patient, and the surgery which can be done in order to control this condition include the colostomy, the sacral nerve stimulator, as well as the sphincter surgery. So here, only if the non-surgical treatment is not helping, then only we would advise the patient to follow the surgical treatment. So here, this is what you can do in order to help the patient cure from this condition. This is about the second condition of today's topic, which is the bowel incontinence. Here we have discussed what do we mean by bowel incontinence, what are the causes, what are the symptoms that one may have if they are suffering from this condition. We've also discussed how we can diagnose, as well as the treatment, which include the surgical treatment as well as the non-surgical treatment. So I hope you have got a clear understanding of this condition. Now let us move on to the last condition of today's topic, which is the flatulence. Flatulence is the presence of excessive flatus in the intestine that would lead to stretching as well as inflation of the intestine. The three primary sources of flatus are the actions of the bacteria on the chyme in the large intestine, the swallowed air, as well as the gas that diffuses between the bloodstream and the intestine. So as we know that most gases that are swallowed is being expelled through the mouth. However, there are a large amount of gas that can also accumulate in the stomach, which could lead to an abdominal distension. As we know that most gases that are swallowed are also being expelled through the mouth. However, a large amount of gases can also accumulate in the stomach, which would ultimately result in gastric distension. So the gases which are formed in the large intestine are being absorbed through the intestinal capillaries into the circulation. So this is what we mean by flatulence. Now let us move on to the causes. Here there are various factors that can lead one to suffer from this condition. The first cause is the food items. So here certain food items that can produce more gases can lead one to suffer from this condition. For example, onions, cabbage, and even peas. The second is the excessive swallowing of air along with food, carbonated beverages, or if a person has the habit of smoking, chewing gum, as well as if they use a straw when they are intaking or when they are consuming any drinks, then this is also one of the cause. If a person is under certain medications that can slow down the intestinal motility, then it can also lead to this disease condition. And the action of certain bacteria in the intestine can also produce gas. So here, these are the causes of this condition. Now let us look at the signs and symptoms. The first one is belching. The second is abdominal distension. The third is increased frequency or excessive instances of passing gas. The fourth is foul smelling gas. And the fifth is the abdominal pain or cramping. So these are the 5 symptoms that a person having this condition will be complaining of. So how can we manage this condition? Here, if this condition is severe, then it is highly recommended that the patient must be kept nil per oral in order to provide rest to the gastrointestinal tract, as well as to give them time to expel the air or the gas which is present. We must also advise the patient not to hold their gas. We can also help them manage this condition by passing a flatus tube. This is nothing but a tube which would be inserted into the rectum at least 4 to 6 inches, with the other end immersed in the water in K basin. So here, once this is done, we must watch for the expulsion of gas, which would be seen bubbling in the water which is present in the K basin. And this can be kept in position for at least 15 to 20 minutes. So this is one of the method which could help a person who is having this condition. However, this is not commonly practiced now. We can also provide medications that would help the passage of stool or gas. We can also perform a procedure known as gastric lavage, where we can decompress the stomach of the patient by using a nasogastric tube. We must also advise the patient to avoid any gas-producing foods. However, this may vary from one person to the other depending on their gastrointestinal functioning, because here for some person, certain foods can lead to the development of this condition. Certain foods can produce gases, whereas in some patients, if they take these same food or if they consume the same food, then this might not produce gases for them. So here, depending on the condition, depending on the food habits, as well as depending on the food tolerance, we must advise the patient to avoid consuming certain foods which can lead to gas production in their gastrointestinal system. So now we have come to the end of this topic, whereby in today's session we have discussed about the 3 conditions that can lead to alterations in bowel elimination, which include the bowel impaction, the bowel incontinence, as well as the flatulence. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.